Hi guys, so today I wanted to do a video on making mistakes as a new grad nurse, or not even just as a new grad nurse, but as an experienced nurse, we still make mistakes, and I feel like people have this idea that nurses, doctors, healthcare workers cannot make mistakes because if you make a mistake, it can cost someone's life, which is so true, and that's what makes nursing and the healthcare field a scary environment to work in when you're have to be so fearful and cautious of making those deadly mistakes. But today I wanted to kind of talk about those, I don't want to call them little mistakes because they're still mistakes, but those mistakes that can be fixed, that didn't necessarily cause anything too extreme to happen. But I want to talk about making mistakes because I feel like when we make a mistake, we have to hold it inside and we don't want to let anyone know because we feel like that if we tell them we made a mistake, that it's going to look poor on our nursing abilities or our capabilities, or people are going to look down on us. So I'm going to share two mistakes that I have made recently that I have kind of been carrying with me because it does frustrate me when I make mistakes and it bothers me, and I try not to let it weigh down on my shoulders, but I'm going to be honest, I go home and I kind of feel guilty, or I feel like disappointed in myself, and so I want to share these mistakes with you guys because I'm sure if you're a nurse you can relate, or if you're a nursing student, I want you to know that it is okay if you do make mistakes. It's just how you go about approaching it once the mistake is made. So the first mistake, one that I have made recently, is with an antibiotic. My patient was getting an antibiotic, and on my floor we have to mix a lot of our antibiotics. I know a lot of hospitals, the pharmacy will do it for you, but for my hospital and where I'm at, we have to take a little mini bag or 100 milliliters of normal saline. We have to take the antibiotic and you kind of plug it in, you pour the saline back in the little jar, you shake it up to mix the powder in, and then you have to flip it over and squeeze the antibiotic back in the saline to mix it up. Well, one mistake that I made recently is I, mixed up my antibiotic. I went and hung it, and the patient got the 100 mils of the antibiotic, and I went in hours later to, rechange and put the next antibiotic up, and I realized that I'd never poured the antibiotic back into the bag of saline. So my patient thus just got 100 milliliters of saline and didn't get their antibiotic, which can be, depending on the sickness level or acuity of your patient, that can be very bad if they have a very bad infection and are requiring that scheduled antibiotic. So that was a pretty big mistake that I have made. The first thing I went and did is I let my charge nurse know, and I said, well, I don't want to say I was panicking, but I was kind of like, I made a really dumb mistake. What do I do about this? So what I ended up doing is I called the pharmacy. I let them know. I had charted a nursing note. I went and talked with the patient, and we got the antibiotic rescheduled to be given now, stat, I guess you could say, since it wasn't given earlier. So overall, the situation was handled, and that, put a little mental note in my head that every time I go and mix antibiotics, I need to make sure that I dump them back into the normal saline bag. And it's just such a simple thing, but at the same time, when you are busy and you're rushing and you're trying to get the antibiotic hung on time, and then it's just a simple thing where you forget to put it back into the normal saline bag. And I talked to my preceptor that I had been paired with, and even though we're not paired together anymore, I go to her a lot just for advice and help. And I said, I just need to ask if you've ever done this because I feel very, very silly. And I told her, and she's like, oh, I have done that. And she's like, and those are types of mistakes where you just put a little note in your head and you be extra cautious and careful the next time you do it, which is so true. And I think that's the important thing, is that we learn from our mistakes and that we don't do them again, or that we're extra cautious. The next mistake that I made recently, and this one really, it made me sad because of how it affected the patient, I guess, so to speak. But my patient had a port, and I was doing a kind of a dressing touch-up on the port, and some of the tape had kind of come up. So I just wanted to use my scissors to cut that off, and then I was going to reinforce it. I just didn't want anything sticking up where it could, get peeled and, expose the port to open air. And so when I was using my scissors, I was carefully cutting the dressing and I accidentally snipped the little line that comes out of the port. And so what ended up happening is I had to de-access the port, so take the needle out of the port, and then take a new port and a new needle and re-access the port and get all the dressing on and everything. And so I felt sad, I felt bad for my patient because it was totally my mistake, and it's not exactly a comfortable procedure to have when you have to get a port re-accessed, because that area can be very tender, and for my patient it was. So I did feel bad, I did feel sad. Luckily it was something that could be, you know, fixed and just redone, and it ended up being fine. But again, that is a mistake that I have made recently, and I definitely learned from it. I am not taking scissors close to the port line ever again. But in all seriousness, mistakes happen, and it's how we think about and digest and react to those mistakes that is important. I am thankful that I have not made any mistakes that are life-threatening. When I did my CCU rotation, I had a great mentor and nurse that I was paired with, and he told me that he's like, in your nursing career, there's going to be a time that you make a mistake that could potentially cost someone their life, and how you react to that mistake and how you process it will say a lot about the type of nurse you are. And you know, some people will either shy away from nursing and never come back, and some people will use that experience to make themselves a better nurse. And that's really a scary thought to think of, that potentially in my career I could make a mistake that could cost someone their life or put their life in danger, and I hate to think that that could potentially happen. But that's why we have to be extra cautious when we're nurses. We have to always double check, triple check, quadruple check our medications, make sure we're doing things by the policies, by the procedures, talk with other nurses, get help when you need it, because it's important that we keep our patients safe and that we keep our patients healthy. Alright guys, I'd love if you could share some stories about if you've made some mistakes and what they were. Let's not be scared to share our stories, because our stories could potentially help someone else from making the same mistake. Give this video a big thumbs up and subscribe to my channel, and I'll see you guys next time. Bye!